about a minute away. You can start at any time.
Okay, thank you very much. My name is Laura Biven, and I'm part of the AIM Ahead team here at NIH, and it's my pleasure to invite Dr. Susan Gregorek, the Associate Director for Data Science and the Director of NIH's Office of Data Science Strategy, to open this webinar. Susan?
Thank you so much, Laura, and good afternoon, and thank you for joining us today. It is my pleasure to kick off this technical assistance webinar for the Artificial Intelligence and Machine Learning Consortium to Advance Health Equality and Research Diversity, the AIM Ahead initiative. NIH recently published a solicitation to establish the AIM Ahead Coordination Center, which we intend to support through other transactional authorities. The purpose of this webinar is to give you additional insights into the structure of the AIM Ahead Coordination Center and how to apply, as well as to introduce you to other transactional awards. The AIM Ahead initiative is an important and flagship initiative for NIH and artificial intelligence, and it's also a flagship effort to reduce health disparities. Through this initiative, NIH will broaden the benefits of artificial intelligence technologies to reduce health inequalities and cultivate a diverse set of leaders for AI for biomedicine. We need your help and your ingenuity to make this work. I hope that you will consider submitting your ideas as letters of intent in the next week. I would like to turn over to Mr. Christian Evans to run through a few logistics for our webinar today, and thank you again for joining us. It's a real pleasure. Christian?
Welcome to the AIM Ahead webinar. My name is Christian Evans. I am part of the NIH AIM Ahead team, and I will be the moderator for today's webinar. This is the agenda for today's webinar. First, we will hear from the AIM Ahead team on the content and structure of the recently released Research Opportunity Announcement, also called AROA. Then we will hear about the other transaction authority that NIH will use to make awards. And finally, I will walk through some frequently asked questions. Next slide. I would like to mention a few housekeeping items before we start. All phones are muted. If you have questions during this session or later, please send them to the AIM Ahead ROA mailbox. Questions and answers will be posted to a FAQ on the AIM Ahead website. And finally, this meeting is being recorded and will be available on the AIM Ahead website as soon as possible. I'll now turn it over to my colleague, Dr. Dina Palto, to speak on the AIM Ahead purpose.
Great, thank you, Christian. Next slide, please. And next slide. So what is AIM Ahead? You heard from Dr. Susan Gregorek that AIM Ahead stands for Artificial Intelligence Machine Learning Consortium to Advance Health Equity and Researcher Diversity. But what is this consortium? It's an innovative and transdisciplinary framework that transcends scientific and organizational silos to tackle the complex drivers of health disparities and inequities. Through this consortium and through this initiative, NIH is hoping to establish mutually beneficial and trusted partnerships to increase the participation of currently underrepresented researchers and communities and enhance the capabilities of AI, ML technologies and approaches both in and for these communities. Through this initiative, we want to build capacity and capability in many ways by coordinating data and computing infrastructure, through training to achieve a diverse data science workforce, as well as to allow for access to high quality, diverse data sets from diverse populations and sources. Additionally, we aim to support research questions that can use data such as that from electronic health records, as well as to connect the social determinants of health and other data, including genomics, imaging, and other types of data, to not only address biases and lack of data, but also to develop predictive models and incorporate community engaged research into this approach. All in all, the overall goal of AIM Ahead is to redress the challenges of health disparities and health inequities using AI ML. Next slide, please. This is just an overview of the key activities and deadlines that are coming up in the next few weeks. We recognize that this timeline is very tight without much flexibility, but it's very important to work on these deadlines as we have them, and our goal is to really award these dates before the end of the fiscal year. I'd like to highlight that we are also offering 15-minute appointments for potential applicants who are interested in meeting with the AIM Ahead staff. You'll find a link to these appointments on the AIM Ahead webpage. There are two categories: that for technical and financial policy questions, in which you can meet with staff specialists on the other transaction awards, or also with scientific staff and program officers through the scientific or programmatic questions link. Appointments will begin tomorrow and will continue through the letter of intent deadline on July 22nd, next week. Next slide, please. So even though there were many components to the timeline, these two deadlines are the most important that you should keep in mind. Letters of intent are required and must be received by email by July 22nd, by 5 p.m. local time of the applicant organization. NIH will then review these letters of intent to determine which groups will be invited to submit a full proposal. NIH will only consider the proposals that we have invited, and the full proposals are then due by August 3rd, according to the time indicated, and should be submitted through ASSIST. And you'll hear more about the details of these timelines later. I would now like to turn the agenda over to Dr. Laura Biven. Thank you.
Thank you. You can go to the next slide, please. So the first thing I'd like to say is that this research opportunity announcement is the beginning of a longer effort. So let me start with the longer term goals of the AIM Ahead program and then walk back and explain how we're initiating the program now. The goals of the AIM Ahead program are to establish mutually beneficial, coordinated, and trusted partnerships that will enhance the participation and representation of researchers and communities currently underrepresented in the development of artificial intelligence and machine learning, and also to address health disparities and inequities by improving the capabilities of this emerging technology, beginning with the use of electronic health records and extending to other diverse data. Next slide, please. A cornerstone of the AIM Ahead program is increasing the diversity of people represented in the AI and machine learning data sets, and also increasing the diversity of leaders in AI and machine learning and health disparities research. And this will be achieved by bringing together institutions and organizations that are interested to develop capacity in AI and machine learning, to build a more inclusive basis for AI and machine learning that have a core mission to serve health disparities populations. So this is what we call the AIM Ahead Consortium. And this blue band around circular band shows some examples of the type of institutions that we expect to see in the consortium. But this consortium will take time to develop, and the institutions that will participate will have a variety of priorities, research interests, capabilities, and resources. So that's why we're initiating the AIM Ahead program with the establishment of a coordinating center in a 2-year assessment, planning, and capability phase. That coordinating center is shown by the triangle in the middle. Next slide, please. The research opportunity that we published earlier this week will result in the awards for the AIM Ahead Coordinating Center, or ACC. And it's through the ACC that the consortium will be established. So in particular, the coordinating center will recruit and establish the consortium and focus on coordinating assessment, planning, and capability building. As you look at this slide, even if you don't see yourself as participating in the coordinating center itself, you may want to be part of the AIM Ahead program as a member of the consortium. And that would mean working with the coordinating center once it's awarded. Next slide, please. At the end of this 2-year period, the Coordinating Center is expected to provide information that will help NIH build the next phase of the AIM Ahead program, including information about near, mid, and long-term research priorities, training needs, and infrastructure needed to support these. At the same time, this is not just a time for planning, and the Coordinating Center is expected to seize opportunities to catalyze rapid advancements in AI and machine learning capabilities. So this could mean investing in hardware or data resources or implementing training activities. So the Coordinating Center will also be responsible for establishing and managing relationships with other stakeholders, for example, private sector data and hardware providers, and also with other NIH-supported efforts so that existing resources can be leveraged. Next slide, please. So now I want to just talk a little bit about the structure of the Coordinating Center itself. The consortium is expected to be very diverse in terms of its research interests, preferences around data sharing and data governance and training needs. So a one-size-fits-all approach to infrastructure, training, and research and engagement is unlikely to achieve the overall goals of the AIM Ahead program. The Coordinating Center, therefore, will have dedicated efforts in each of the following areas: leadership and administration, data and research, data science training, and infrastructure. The Leadership and Administrative Core will have the overall responsibility for managing the consortium, the Coordinating Center. And the other 3 cores will provide technical and scientific expertise and capabilities. Each one of these cores will be discussed in more detail in just a moment. Next slide, please. I wanted to give just a note about how to apply with respect to these 4 cores. NIH plans to review each of the cores separately. So you can submit an application that addresses 1 or more cores, and we will review those cores separately, or you may submit 1 application per core. That's up to you. I'd like to now turn it over to my colleague, Dr. Robert Starr, to discuss the Leadership and Administrative Core.
As the name implies, the purpose, next slide, please. As the name implies, the purpose of the Leadership Administrative Core is to provide the overall leadership and management of the AIM Ahead Coordinating Center, as well as the overall consortium, which includes the other 3 cores. The Leadership Administrative Core will ensure that the consortium works cohesively and effectively with the consortium and other stakeholders. One of the golden nuggets of this is the ability to involve the health disparities populations very, very early on in the planning for this, so they're involved from the very beginning and not just asked at the end to provide their data. This core therefore recruits and manages consortium members and builds the trusted relationships with groups affected by health disparities. The Leadership Administrative Core requires substantial project management capabilities to ensure coordination among the different activities, to ensure activities stay on time and on budget, and to flexibly meet the needs of the potential consortium members as they join the consortium as the assessments mature. Please see the research opportunity announcement for full details. I'll now turn things over to my colleague, Dr. Deborah Duran, to discuss the Data Science Training Core.
Next slide, please. In the Data Science Training Core, the purpose of this core is to assess, develop, and implement data science training curricula to enhance the capacity among the members of the consortium, which will be recruited and developed by the Coordinating Center to conduct health disparities research using AI, artificial intelligence, or machine learning, ML, that utilizes electronic health records and the social determinants of health data. The consortium will represent diverse population groups, specifically underrepresented or underserved groups impacted by health disparities. The core should consider fostering interdisciplinary skills both in data science and in biomedical research for people from diverse backgrounds across the career pipeline from undergraduate to senior investigators. Training should address areas of data science needed for artificial intelligence and machine learning, for data curation, preparing and cleaning for health disparities research using AI and ML, and tools and resources that enable the linking of data from research projects with social determinants of health and with electronic medical records, and foster biomedical knowledge, skills, and abilities in data science, AI, or machine learning experts. Applications to this core should also consider fundamental competencies such as cloud computing, ethics, bias mitigation, distributed computing, data interoperability, and biostatistics. Please see the research opportunity announcement for the full details. And now I'll turn this over to my colleague, Michael Chang, to discuss the data and research core.
Deb, thanks. You can go to the next slide, please. The purpose of this core, data and research, is to determine and address the research priorities and needs in linking and preparing multiple sources of data and different types of research for the consortium members. So through this data and research core, the coordinating center is going to do really three things. Number one is to determine the AI and machine learning and the health disparities research use cases that are going to drive the design of the infrastructure and associated artificial intelligence and machine learning computing models and the training offerings. And so that's how this core connects with the other ones. The second thing is that this core is going to carry out the pilot AI and machine learning projects together with the consortium members to collect and to prepare the clinical and the biomedical data. And as pointed out by Dina, that data could be a wide range of EHR data, image, social determinants of health data. And number three, this core will prepare and to support the use of either existing data resources or purposely built data resources for AI and machine learning applications, and also for health disparities research. So the full details are, of course, given in the research opportunity announcement. And I'm going to turn over to my colleague, Alistair Thompson, who's going to discuss the infrastructure core now.
Next slide, please. So the purpose of the infrastructure core is to assess the infrastructure needs of consortium members and to test different computing infrastructure tools and governance models. As Dr. Bivens said, there's a diversity of capabilities there. And so we want to be able to provide a diversity of capabilities to build capacity. I want to say that we're taking a broad definition of infrastructure, which includes hardware capacity, software and tools, shared data repositories, cloud capacity, and common policies for things like data access. We're also interested in infrastructure across scales, from laptops for teaching to laboratory servers to data center capacity to public and hybrid cloud. And so through this core, the ACC will determine data sharing models that facilitate AI and ML and meet the needs of the consortium members. And to meet the needs of the consortium members is really critical here. Enhance the capacity of consortium institutions and organizations to prepare data for AI ML and then engage in AI ML research, and to establish pilot data access and analysis environments to enable AI ML applications and to better assess the needs, challenge, and opportunities for future infrastructure investments. And as my colleagues have said, please see the research opportunity announcement for further details. And I'll turn it over to my colleague, Dee Druckberg, for some information about the other transaction authority.
Thank you. Next slide, please. So we're going to switch focus a little bit away from the scientific programmatic part and go into a little bit about the OT2, which is the other transaction mechanism. This might be a new mechanism to most of you, used to either grants or contracts. These are funding instruments which do not incorporate the standard terms and conditions of the OMB circular, the NIH grants policy statement, and any FAR-based contract requirements, but rather all terms and conditions are negotiated between the federal sponsor, NIH, and on a case-by-case basis with the applicant or awardee. Substantial and active NIH program negotiations and management before, during, and post-submission and award, and at the end of the project. These are milestone-driven projects supported by deliverables and with contingency plans. There are special award terms that are negotiated, and there's flexibility to alter the course of the project, either through expansion, modification, or discontinuance, and to design unique collaborations with other partners and between awardees. Next slide, please. So we talked a little bit about what OTs don't encompass, and here are some things that they are responsible for and some OT regulatory requirements. Here's a list of things. This is not meant to be an exhaustive list. These are just some requirements that you would have to adhere to as an awardee. Next slide, please. So we talked a little bit about that there will be specific award terms that are negotiated. Here are some sample or examples. Fund projects in increments and or with options for continued work at the end of one or more phases. Fund projects of two or more entities, potentially across different applications, as part of a reorganized collaborations or with teaming arrangements or other means acceptable to the government. There will be special reporting requirements. There will be requests for additional documentations or certifications, and the ability to remove participants from award consideration should the parties fail to reach a fully finalized executed agreement prior to the date determined by NIH, or the proposer fails to provide requested additional information in a timely manner. Next slide, please. So with the other transaction authority awards, they highly are based on negotiation. Again, pre, during, and post award. They're highly interactive. You will be asked to submit an electronic application that will include a formal statement of work with deliverables and milestones, detailed budget information, and other certifications. The applications may be negotiated prior to submission after a formal request for negotiation is issued by the OT official. Negotiations may be recorded and documented by the NIH, and NIH will likely interact with different and multiple investigators. Formal applications need to be submitted no later than August 3rd, 2021, 5 p.m. local time of the applicant. The recipient of the award will be expected to comply with all the regulatory requirements listed in the OTA. NIH expects to make the award no later than early September. The scope of work, milestones, and deliverables and performance requirements will be finalized through the negotiation and memorialized on the notice of award. Next slide, please. Here are some post-requirement requirements for after the award. Again, this also is an interactive process. All terms and conditions will be in the OT agreement. These can be amended and modified during the course of the award. Generally, payments align with the achievement of milestones, and a payment schedule will be negotiated prior to issuance of the award. Financial and progress reports are required. The frequency and the contents will be negotiated and put in the OT agreement as well. Organizations will be asked to implement management controls and management roles for staff. Organizational conflicts of interest must be disclosed and managed, and NIH will determine mitigation plans or need for any potential waivers. Next slide, please. So I know we've stressed several times throughout the course of this presentation that we realize this is a very assertive and aggressive timeline. And so I just want to reiterate again that the letter of intent, or the LOI, is due July 22nd, 5 p.m. of that of the applicant. PDF file must be sent via email to the email address listed. The LOI is not binding. NIH will use the LOI to determine which individuals or groups to invite to submit full proposals. NIH plans to notify applicants within days of the submission deadline. For those that are move on to the full proposal stage, those will be due August 3rd, 2021, 5 p.m. local time of the applicant. You will be submitting applications through NIH's Assist mechanism. Applications can be for one or more cores. Cores will be reviewed separately. NIH does not have a preference of applications for multiple cores. Next slide. I will now pass it over to my colleague, Mr. Christian Evans, to go over frequently asked questions.
Okay, thank you. Next slide. Question: what is the annual budget for this award? Answer: the annual budget for the entire AIM Ahead program is $50 million. Some of this will support coordinating center institutions themselves. It is expected that most of these funds will be used by the coordinating center to support engagements, investment, and projects with or for the consortium. Next slide, please. Question: do all cores have to be led by an institution with a core mission to serve underrepresented or underserved groups impacted by health disparities? Answer: NIH is particularly interested in applications led by institutions and organizations that have a core mission to serve underrepresented or underserved groups impacted by health disparities. The PI for the Leadership Administrator Core should be from such an institution or organization. For applications from more than one institution, this applies for the contact PI on the application. Next slide, please. Question: what is the definition of a core mission? Answer: demonstration of a core mission may include dedicated programs or activities focused on unique needs of these groups. Next slide, please. Question: how would the consortium be formed? Answer: the Leadership Administrator Core will collaborate with the other cores in the ACC to recruit and establish a consortium during this award period. Next slide, please. Question: NIH will use the letter of intent to decide whether to invite full applications. When will NIH notify those who have submitted LOIs? Answer: NIH will review the letters of intent and aims to send notifications and invitations to submit a full proposal within a few days of the letter of intent submission deadline. The exact dates are still tentative. Next slide, please. Question: will NIH consider proposals that were submitted by the deadline but not invited? Answer: no. NIH will only consider invited applications. Next slide. Question: what if the details in my letter of intent change? For example, what if I form new partnerships after the letter of intent is submitted? The letters of intent are not binding, so changes between the letter of intent and full application are permissible. Next slide, please. Question: does NIH expect multi-institutional teams to be fully formed by the time they submit letters of intent? Answer: applicants do not need to have fully formed multi-institutional teams when submitting the letter of intent, but including information about your plans will help us review the letter of intent. Teaming arrangements can be proposed in the full applications. Furthermore, through the OTA, NIH may select components from the applicant pool to form teams that best meet the needs of the program. Next slide. Question: how is NIH using input from the RFI and the virtual forum? We use feedback from the RFI and virtual forum to inform the development of this research opportunity. The feedback we receive will also help plan future stakeholder engagement and the phases of the AIM Ahead program. Next slide, please. These are your program contacts. If you have any scientific research questions, please send any email to the AIM Ahead team. And if you have any financial questions, please email Ms. Dee Rudberg. Next slide. On behalf of the AIM Ahead team, I would like to thank everyone for dialing in. Please do not hesitate to send questions to the AIM Ahead ROA email address or sign up for an appointment with our team. We look forward to hearing from you. Thank you.
This is Laura again. Let me just reiterate my thanks from the AIM Ahead team. Thank you very much for your interest, and we look forward to hearing from you either through our email inbox or through letters of intent. We're excited to hear from you as we initiate this exciting program. Thank you very much.